Welcome, ladies and gentlemen, to the episode 1 of Beyond the Surface, a Psoriasis podcast. I'm Sophia Lovi. I'm honored to be your host today. Today, we have Dr. Azura, who is a consultant dermatologist, Hospital Kuala Lumpur, and also Neeraj, who is a person living with a condition called psoriasis. Okay, thank you so much, both of you, for making the time today. And over to you, Dr. Azura.
Thank you very much, Sophia. Hello, how are you, Neeraj?
I'm doing good. How are you?
All right, I'm doing well. Thank you very much. Thank you for being with us today. So we're just going to go through about your experience at living with psoriasis.
Sure.
If you don't mind telling us, how long have you had psoriasis?
So I first was diagnosed in 2019. So it's been about 4 years now. And it's been quite the journey. A lot of ups and downs, a lot of difficult moments throughout.
So at that time, did you know what psoriasis is all about?
No, actually, when I went to a GP to check out, actually, the first thing that I was concerned about was a lot of scaly patches and flakes on my scalp. So I thought it was dandruff, but it wasn't going away despite using anti-dandruff shampoos. So I went to a doctor to check it out, and at that point of time, it started to get a little worse. There were small patches on my body as well. So he diagnosed it very quickly as psoriasis, and that was the first time I've ever heard of psoriasis.
I know psoriasis is not as common as some other skin condition that you may have heard of, but psoriasis, we can best understand it as a overreactive of our immune system, which actually causes the skin to become thickened, because our skin changes gradually, but in psoriasis, the skin changes very quickly, which causes a red, thickened, erythematous or red patches on the skin, and it's covered by silvery scale. It can occur on various parts of the body, and you mentioned just now you started having dandruff.
Yes.
Yep, scalp is one of the commonest area that's affected, followed by the elbows, the knees, the back, but basically it can occur on any parts of the body. And there are a few types of psoriasis. And may I ask, what type of psoriasis do you have?
It's just red patches.
Yeah,
so it's
I think what you had is
yeah.
what we call plaque psoriasis.
Okay.
And plaque psoriasis is the commonest type of psoriasis, which account to about 90% of cases. And the other types that's not so common are like erythrodermic psoriasis, pustular psoriasis. Those are not as common as plaque psoriasis. Psoriasis can affect the joint. Did you know that?
No, I didn't actually.
Yep. So psoriatic arthritis is one of the conditions that a patient may have, and it occurs in about 30% of the patient.
I see.
And it causes pain on the joints. It's all part and parcel of psoriasis as well.
I see.
The other thing that people always mistaken is they always think that psoriasis is contagious, but psoriasis is not contagious. You can't get psoriasis by touching another person with psoriasis. And I'm sure, did you get that initially when you first diagnosed with psoriasis?
Yeah, I mean, there's a lot of stigma, and there was a lot of negative reaction. I think people are not really aware of psoriasis. So when they start seeing somebody who hasn't had it before, and then suddenly you've got these patches on your arms, they don't really know how to respond. So I did get some I would say, tough responses from some people who maybe they didn't really know about it, so they were asking very blunt, very direct questions like, what's wrong with your skin? Or, shouldn't you go check it out? When you really know about the condition, then I think you wouldn't approach it in that way.
Yeah, I think there's a common misconception that you can get it by touching or even being in contact with a person with psoriasis, but that is actually not true. Okay? So we need to educate the public about this condition so that patients do not suffer unnecessarily from public's misperception.
Yes.
So Neeraj, can you tell me, when do you first observe having the red patches and plaques? What do you think causes it? Do you think it's something because of body's reaction, or did you know what was going on at that time?
I mean, it took me a long time to actually identify, and since then I've lived with psoriasis now for 4 years. I've noticed that at that point of time I was experiencing a very high level of stress in my personal and work life as well. So at that point, I think the biggest trigger for me was stress. And since then, I've had periods of remission and then periods of flare-ups again as well, always related to very high periods of stress in my life.
Yep, I'm glad you mentioned stress, because even though we don't know what's the cause of psoriasis, but there are a few triggers of psoriasis, and stress is actually one of the important triggers of psoriasis. So apart from stress, there are also other factors like environmental factors, certain medications can also trigger or even aggravate psoriasis. Example, if you have like infection,
Okay.
have you ever had like you've been unwell with runny nose or sore
Actually,
throat, and then that actually triggered your
Interestingly
psoriasis?
enough, last year when I had COVID, for the second time, my psoriasis did flare up a little bit. So infections do, I think, trigger flare-ups of psoriasis.
Yeah, I'm not surprised to hear that, because we do see cases in our clinic where patients get quite bad flare-ups after each infection.
Okay.
And we also always advise patients to take good care of their health, because, for example, alcohol consumption, smoking, that can also cause a flare of psoriasis.
Good diet as
Do
well.
you smoke?
I used to actually, but then
So
I've
you have
stopped.
quit.
Yes,
That's
I've
a
quit.
good
Yes.
decision, because smoking can definitely worsen psoriasis.
okay.
So it's something that you would want to avoid.
Okay. Does diet have any play into it as well?
Right, diet is a very common question that gets asked by patients to us. There's actually no proven which diet actually can worsen or trigger psoriasis, but I've had many patients who say if they avoid certain kind of food, their psoriasis get better. So what I tend to tell them is, if you feel any particular food aggravate or worsen the psoriasis, then they should avoid it. But there's no proven, there's no proof that says
Okay.
that any diet to be avoided.
Okay.
The other thing is, you're very young. This psoriasis can affect people at any age, whether it's men or women. The age group is usually about the same.
Okay.
And it's not just in Malaysia. Psoriasis is found throughout the world. It can occur at any patient background, any educational class, any socio-economic background. Because what actually happen when they have psoriasis is they have all these visible patches on the skin, and coupled with widespread ignorance and public misconception about the disease, it's something that we need to correct.
Yes, I fully agree.
And I do understand that you also mentioned that when you first had it, that some people thought that it's contagious. And did you like withdraw from the society because of that?
So I used to actually really enjoy going for sports. Like I used to play a lot of sports at that point of time, playing football or yoga. I found myself wearing more long sleeves, just to cover some of the areas. Or when I used to go to work, I would cover up as well as much as I could, because sometimes it's easier to cover up than to face the tough questions. Yeah.
Yep. I mean, like, I understand your concern, because if people do not understand, they will think that it's something contagious, that they can
Yes.
get it from touching. And that actually has resulted in social avoidance and embarrassment in people with psoriasis. Okay? So many become socially withdrawn, they have low self-esteem, and some even actually go into depression. Yeah, so it's good to surround yourself with people who are
Yes.
positive, okay? But because sometimes the psychological suffering can be more severe than the physical suffering. Right, so did you have any flares after you were diagnosed with psoriasis, and can you recall what actually triggered them?
I think the biggest flare that I had, actually I'm experiencing one now in this period of my life. So in 2019, when I first was diagnosed, it took me a couple of months for the condition to sort of go into remission again. And then I had a bit of another flare last year after contracting COVID. And then it went down again. And now this year as well, I'm going through another small flare at this point of time. And for me, everything I've seen, it's either when I was ill, having a infection or flu or virus, or when I'm going through a period of stress.
Yep, as we've already discussed just now, there are many triggers
Yes.
of psoriasis. Same thing that can trigger the appearance of psoriasis. The same stress, medication can also trigger or worsen psoriasis.
I see.
So the other thing, it's flares is usually unpredictable. Okay, so you feel okay one day, and then another day,
Yes.
you can get flare basically like any time, right? So I think that unpredictability part it's actually quite a hassle to most of patients.
It's having to really have the resilience to face the flare, be patient, be kinder to yourself, do the right things in terms of your diet, your exercise, really getting back into a good routine that will help you go back.
Did you find anything help you during when you were having the flares? Anything help?
So I think for me, what I tend to stick to whenever I have a flare is maintaining a really good diet. So I try to avoid red meat, try to avoid alcohol, lower my gluten intake. Those seem to work for me. And also making sure that I've got plenty of good exercise, good sleep, good rest. I do meditate, I do yoga, journaling, all the things to keep my mind and body in a good sense of balance.
Yeah, it's good to keep yourself positive.
Yes.
Yeah. Okay, and the other thing that which I've already mentioned just now is good to like what you have done, join the society, Psoriasis Association of Malaysia. So they are a very wide support group that can actually provide support to patients with psoriasis.
Yes.
Right. So the other thing what we're going to talk about is you've already shared with us how you were diagnosed and what triggered the flare. So now we're going to talk about comorbidities. Okay. So basically, comorbidities are other diseases that can be associated with psoriasis. So apart from the skin involvement, do you have any other condition that's related to psoriasis?
No, nothing.
Right. So that's good to know. Okay, but some patients with psoriasis, they can also get other comorbidities. We've already mentioned psoriatic arthritis. That is quite common, which occur in about 30% of a patient. But some can also have, for example, cardiovascular disease, metabolic syndrome, high cholesterol, or we call it dyslipidemia, diabetes, osteoporosis, GI problem, gastrointestinal problem, liver disease, okay, and so on. Right? Okay, so I'm glad that you didn't have any of that long list there.
So it would be good for psoriatic patients to do regular checkups then to make sure overall health is good.
And there are certain types of psoriasis which will predispose patient to have all these comorbidities. For example, if they have more severe psoriasis, so they're at a higher risk of developing those comorbidities.
Okay.
Right, so we already covered about that. So the other thing that I wanted to know, at what age did you first notice that you have psoriasis? And anyone in your family or someone close in the family has psoriasis?
So for me, it was when I was 27. I'm 31 this year, so 4 years ago. In my family, so far, from what I've checked, both mom's side, dad's side, nobody has psoriasis, but there have been cases of eczema. So that's the closest thing I could find related to psoriasis in the family.
So eczema is a totally
that's the only
different disease. But it's actually not surprising that you do not have anyone in the family with psoriasis. Although having a positive family of psoriasis is a risk factor of to anyone to develop psoriasis, and about a quarter to a third of patients with psoriasis actually have somebody in their family with psoriasis. But you don't really have to have anyone in the family with psoriasis to have this disease. And if you have one or both parents with psoriasis, chances of you of getting psoriasis is actually higher.
I see.
All right, so we have covered quite a few things from how you were diagnosed, the age of diagnosis, and we covered about your flares and whether you have any comorbidities or not. Thank you, Neeraj, for sharing your experience with us today. I'm sure it will be beneficial for others who are living with the same condition. Now back to you, Sophia. Would you do us a favor of summarizing what was the discussion that we had today?
Of course, Dr. Azura, definitely. Thank you, Dr. Azura and Neeraj, for your valuable sharing. In summary, psoriasis and psoriatic arthritis are lifelong condition and one that needs ongoing management. Unfortunately, there is currently no cure for psoriasis. Although there are many treatments, options available that can reduce the inflammation and symptoms of the disease, in recent years, new and improved medications and treatment approaches have helped to enhance treatment of these conditions. For more information, please reach out to Psoriasis Association of Malaysia, and you can also reach out to them via Facebook and Instagram. Thank you for joining us on this episode, Beyond the Surface, a psoriasis podcast. And make sure don't miss the next episode and see you soon.